the vaccination measures are going to be what makes a difference here. And so we began with what's known as phase 1A or healthcare workers. I'm the chief medical officer at an urban inner city underserved hospital, an academic medical center with 5 different colleges of health science, from medical to dental to pharmacy. And so we have a large population of healthcare providers here. So that's where we began, was when in our healthcare provider groups, starting inside of our COVID units. And we didn't do this by job description. This wasn't, physicians line up and then nurses line up and then right down and on. We did it by work unit. And so everybody who was working on the COVID units, from our transporters to our environmental services housekeeping people, our IT support who have to come onto the unit, pharmacy, nurse practitioners, and then our physicians. And so we did it as one global cohesive unit systematically throughout, starting in our COVID units, then going to our emergency department, then going to our units that may have the risk of having COVID patients, like labor and delivery, and just keep working out in concentric rings into our offices where patients are being seen, and to others. And so with our process, we also incorporated education on the vaccine. And so I have the Temple University Center for Urban Bioethics here. They are known for their research in the urban underserved community. They got on board early in this process, began to give us some ideas of what the right language is to use, how to have conversations about vaccine hesitancy, who the right credible messengers are. We did focus groups within our own employees, particularly those who live here in the community, and now we're doing focus groups out in the community we serve. All of that is informing the process of how we reach out to our employees. We start with an email invite. We make an open introduction and a welcome to come get vaccinated move. And then we go through systematically by department to sit down and have the conversations. Did you see the invite? Have you been able to make time? Are there concerns you have about the vaccine? Are there concerns you have about the process in general? And so on and so forth. And we keep working our way through department by department systematically, without regards for, like I said, job description, ethnicity, race. I mean, we are working our way through everyone. Our goal is to get as close to 100% as we can. We're going to use the same methods when we get to the community.